Hello, and welcome to another edition of Cosmetic Corner. My name is Chris Surek, your moderator. This month we have a very exciting special edition with Dr. Marissa Tenenbaum and Dr. Qureshi as they talk about cosmetic training and residency, as well as the mentor-mentee relationship. We look forward to their interview.
Hi, my name is Qureshi. I'm a plastic surgery chief resident at Washington University in St. Louis.
And I'm Marissa Tenenbaum. I'm an attending surgeon here at WashU and the program director.
So we recently wrote a commentary in the Aesthetic Surgery Journal on a paper that was published from Mount Sinai, doing a survey looking at program directors and their opinions about plastic surgery and specifically aesthetic surgery education. One of the major findings of that study was that still only about 40% of programs have a resident cosmetic clinic. Here at WashU, we've had one for about 25 years, and it's been an integral part of our education. Dr. Tenenbaum, can you tell us a little bit about what you think are some of the challenges and the benefits of a resident cosmetic clinic?
Sure. So the benefits of a resident aesthetic clinic are that residents really get to learn firsthand about aesthetic surgery. There is a big difference between watching and attending do a case, for example, and getting to do that case yourself. But beyond that, I think the educational piece of a resident aesthetic clinic is meeting patients, evaluating patients, coming up with plans, then getting to execute those plans under supervision, and then following those patients over time. I think that is a huge piece of education in all aspects of surgery, but specifically with aesthetic surgery, that you don't get quite as well when you're just following and attending around. The challenges of an aesthetic clinic, of course, are a medical legal challenge. It sometimes can be difficult for attending physicians to want to lend their name to a record where they're not fully in charge of the case. So that can be a big challenge. Another challenge specifically with resident training, that's typically done in an academic setting. Academic settings historically have not had as many aesthetic surgeons or surgeons that focus on aesthetic surgery, and so just finding attendings that are willing to staff cases and help out with a resident clinic, but also have the expertise to help out and train.
I think one of the other things that we identified in our commentary and we talked about was that some of the barriers to having a resident cosmetic clinic, aside from the legal aspects and aside from some of the financial aspects, is that some institutions haven't really bought into the importance of aesthetic surgery education as a part of comprehensive plastic surgery training. And I know here at WashU we've talked a little bit about how even non-surgical procedures can complement other areas. So I don't know, can you comment a little bit about how you think non-surgical aesthetic surgery education could affect other areas of plastic surgery?
So I think that it's critical to train our residents in aesthetic surgery and non-surgical procedures for a couple of reasons. Number one, it really does complement all of your skills. Whatever aspect of plastic surgery you're ultimately going to practice, there is some crossover and understanding form and function and all of the principles we teach in terms of problem solving can be applied to all aspects of plastic and reconstructive surgery. Patient interactions and patient relationships can really cross over into all aspects of plastic and reconstructive surgery. But beyond that, if you really look at the numbers of board-certified plastic surgeons in our country who ultimately do at least some aesthetic surgery in their practice, it's extremely high. And so if we as educators aren't training our residents in aesthetic surgery and how to practice in a safe, ethical manner, I think it is a detriment to our specialty as a whole. We really need to take responsibility for that. With regard to the non-surgical aspect, we all know that non-surgical treatments for patients are growing at a very rapid pace. Surgical treatments have been a little bit more steady state, and so again, we really need to be on the forefront of training young surgeons in how to provide these treatments in a very safe and ethical manner so that they can incorporate them into their practices, which they ultimately most likely will do.
And I think for us as residents, because we get to see that crossover as we go from one rotation to another, whether it's fat grafting that we've learned in a cosmetic procedure, or how to give Botox and then applying that to hand surgery and Raynaud's, or learning how to use the CO2 laser and then applying that for post-burn reconstruction. That has really enhanced our education in terms of having really a comprehensive way to learn all the aspects of plastic surgery before we graduate from a residency program.
Absolutely. And of course the opposite is true too. There's so much in reconstructive plastic surgery that crosses over into aesthetic surgery.
So Dr. Tenenbaum, obviously there are programs out there that don't have a resident cosmetic clinic, but residents still need and want to be educated about aesthetic plastic surgery. So if you were going to give a couple pieces of advice to those residents, what would you recommend to them to be able to enhance their aesthetic education?
So I think that there are a lot of great resources for residents, whether they have an aesthetic clinic in their program or they don't, to help enhance and improve their aesthetic education. Obviously, the national meetings, specifically ASAPS, is a tremendous meeting for those of us in practice, but also young residents, fellows, to really not only learn about aesthetic surgery, but help make connections and relationships to develop some mentorship type relationships, which I think can be really important. ASJ has amazing content, both in print and online.
Yeah.
That residents have access to, and there's actually free access for residents, which is a tremendous benefit. Radar, which is also free while you're a resident. Really, I know that my residents love Radar. They go to Radar and watch videos, they look at commentaries, they're using it quite a bit, and actually they'll bring it back and teach us some things too, which is really fun. Also within the residents community. So surely at all of these programs, even if there isn't a resident cosmetic clinic per se, they are getting some exposure to aesthetic surgery, and that could be from a private practice surgeon in the community, or perhaps a staff member that does aesthetic surgery. I think really reaching out to those board certified plastic surgeons in the community and at their own programs to really try to learn about some of these extra resources can open some doors as well. So let's switch gears a little bit and just talk about mentorship. Can you talk a little bit about how important mentorship has been for you up to this point, which by the way, he graduates tomorrow, up to this point in your career?
Yeah, I think one of the hidden curriculum components of any plastic surgery education is mentorship. And unfortunately, I don't think the importance of mentorship really gets communicated to medical students as they're applying for residency, because I think mentorship that I've gotten from you and obviously a lot of our other attendings is how does that form you into the plastic surgeon that you become on the day that you graduate? And how does that affect your perspectives about giving back and being a part of the plastic surgery community? I think mentorship is the hidden curriculum that is what we take away with us in terms of philosophy, in terms of our ethics, in terms of our willingness to continue to be a part of the big picture of plastic surgery.
So you are going to be heading off to do an aesthetic fellowship in a few short days. How do you envision the mentorship that you've had so far and the fellowship that you're about to complete and meet a whole new set of mentors? How do you envision that helping to shape your vision of giving back to the field of plastic surgery?
Yeah, so I consider myself very fortunate to have trained at WashU and then going to Marina Plastic Surgery to do my fellowship there, surrounded by people who really believe in the importance of aesthetic surgery education, but also paying back and contributing to the field, whether that's involvement with ASJ, with local meetings, with national meetings, but also being an advocate for good, safe plastic surgery in our communities and providing excellent care. So I think that combination of being a leader at a national level, but also bringing that skill set back to the community level is something that I've seen from you and also something that I look forward to seeing in my fellowship.
I think that those are really important points, and I think if we want to continue to train really great aesthetic surgeons, that's going to be so important moving forward. I think that also helps set the stage for more programs to look at things like a resident cosmetic clinic and look at aesthetic surgery training as an important component of their program.
Mm-hmm.